The definition of therapy has changed for me over the years. Not only does it have an impact on me professionally, but it had a direct impact on me personally with my oldest daughter. My daughter was demonstrating difficulties in going to Gymboree and socializing with other kids. She was demonstrating difficulties where she feared being around other kids that moved too quickly around her. You could tell that she would hold back because she felt that she couldn't do what other kids were doing, where they were just climbing upstairs and climbing up equipment, and she feared to even take a small step.
So even as a business owner, I didn't really truly understand what occupational therapy was until our daughter started doing therapy. The growth I saw in my daughter was overwhelming. I saw that little by little, she was getting happier, she was being more confident. It really changed our daughter's life significantly.
I think that having experienced that with my own daughter and seeing the impact that that was having on her, even developing friendships, I think for me was a light bulb that went off. And after getting therapy and building her confidence and seeing the change that that made, as a mother, that made me feel more comfortable that she would be okay in life, because she's going to be able to establish friendships and be able to learn things and grow and build her confidence, knowing that no matter how difficult something is, you can still accomplish it.
As a parent, this is a new process. Sometimes you don't know why you're coming to speech therapy or occupational therapy, because the pediatrician hasn't taken the time to really explain what they're seeing. It's kind of a rush process, and you're kind of caught off guard. So that evaluation and that process, we know that it's a lot of information, it's overwhelming, it may feel like you're a little lost. We know that. We will take the time that's necessary to educate you, to bring awareness, to provide resources that may be provided free in your local community. We'll always give you that extra touch because we get it. This is new. We have a lot of answers, and it's so important for us to share those answers with you.
Community outreach is so important because there's children out there that need our services and are not getting them because they have no idea that a therapy exists to help them with getting dressed in the morning, handwriting, social skills, things like that.
In order to provide an individualized approach, we have to look at our patient as a whole. We need to look at their physical abilities, their psychological abilities, and their social abilities. And if we tap into all these different skills, we will be able to provide an individualized care plan. But with that, we also need to be able to incorporate a variety of techniques to be able to achieve that.
Here at Exceptional Speech Therapy, we use a very child-directed approach. We use a very holistic and naturalistic approach to therapy. We use play-based therapy, natural play therapy, where you'll find therapists on the floor playing with children, with toys, with engaging activities that capture their attention, keep them engaged, and while we're playing with them, again in a very natural way, we are working on their language skills, on their communication skills, on their overall social skills, and so much more.
Our job as occupational therapy is to help patients become as functional as possible in their everyday occupations. In the sense of kids, their jobs are to play and to go to school. So that's where we come in. We help them become functional in their play skills and prepare them for later on when going to school. We work on attention, we work on following directions, we work on handwriting, gross motor skills, so building not only their core strength and their hand strength, but it's a whole body strengthening experience.
When a child comes to see me, I make sure to form a connection by tuning out everything around me and just honing in on that particular child and what they need at that moment. I build trust and relationships with parents, with caregivers, with patients in order to get them to a point where they feel confident in themselves to communicate their needs the best way they could.
We're here for every single child that needs us and the parent that needs our guidance. How do you do that? By changing one life, 2 lives, 3 lives, by advocating to parents, to the community about what you do, why it's important, and how that has a lasting effect on our world.
At Exceptional Speech Therapy, we care. But you might say, why do you care? Or how do you care? How do you demonstrate you care? And I think that the most important part is to show that we understand and that we empathize for our families and our patients. So we have a true understanding of the direct impact that these difficulties have in your home environment and have in your child's life. And because of that, we promise to uphold to our values, to help support you and guide you to that success.